Welcome to video 9 of the Search for a Better Health series. In this video, we're going to be looking at microflora and how, while they usually perform a good job for our body, how they might result in disease. So microflora are a mixture of organisms, usually bacteria, that are regularly present in humans. So even though they are present in our body, it is believed that their relationship with our human body is mutually beneficial. So therefore, both both organisms benefit. So microflora benefit because they gain a supply of nutrients from the human body. They are provided with a stable environment and constant temperature, and they're protected um, and transported around by the host. And in fact, the host is protected because the presence of these microflora on the human makes it difficult for disease causing microorganisms to become established and multiply. So they kind of act as a barrier to make sure that anything that might be harmful to our body, um, in fact, cannot take part in trying to cause disease. So, in terms of microflora that is present in the human body, there are a range of flora in a range of different places. So, they're present in the skin, on the skin, in our oral and respiratory tract. There are urogenital flora and conjunctival flora. So, because of the variations of environments on the skin, there are a range of populations that are either really high or spread out a little bit, and they're mainly gram-positive organisms such as Staphylococcus, Micrococcus, or diphtheroids, and they're usually the most common ones that we have on our skin. In the oral and respiratory tracts, there are a range of flora. So they include streptococcal anaerobes that are present in our mouth, so in our gingival crevices. The pharynx can be a point of entry and initial colonization for another range of bacteria. But again, because these are microflora, they are not harmful to the human when they're living. In the urogenital areas, there's vaginal flora, which changes with the age of the individual, with vaginal pH and with different hormone levels. So there are mainly Candida species frequently inhabiting those areas. And then in our conjunctival, so around our eyes, there are almost no microflora, but we do sometimes see a few of these other bacterial species present. So, one of the diseases which we will look at that are caused by an imbalance of microflora is what we term thrush. So, at a normal level, microflora is in fact harmless to the human body. And if the conditions of the body change for any reason, then the balance of the microflora can change, and therefore these microflora are able to grow and multiply. And harmful pathogens which might not have been able to live there before might not be controlled, which can increase in their numbers and therefore develop into a disease. So, thrush is a disease caused by excessive growth of the yeast-like fungus Candida albicans. It naturally occurs in the mouth, respiratory tract, in the female genital tract, and in the gastrointestinal tract. So when they're not kept in check, these numbers of fungus, then a person can experience thrush. The major cause of this is due to antibiotics, as they kill this natural bacteria, because obviously when a person is prescribed antibiotics, it's either specific or a broad spectrum antibiotic, and therefore can kill lots of bacterial disease causing bacteria in the body. And then other contraceptive pills, if a person has diabetes, or sometimes pregnancy, can also cause this imbalance. So some symptoms that a person might experience is itchiness, drying, redness, and swelling. And usually diagnosis is by taking a swab of the infected area. In terms of treatment, we have people might be prescribed antifungal cream, and Sometimes people are encouraged to increase their intake of yogurt, which has natural bacteria, in order to restore the microflora that was in that area previously. That's video 9. Make sure you tune in for video 10.